Naš sagovornik u narednom prilogu je profesor dr. Berezcki Arpad, član tima eksperata Specijalne bolnice Sveti Vid. Vanserijski vitreoretinalni hirurg sa brojnim publikacijama u stručnim časopisima, zapaženim prezentacijama na međunarodnim kongresima vitreoretinalne hirurgije. On danas govori o veoma uspešnoj saradnji sa bolnicom Sveti Vid i koje su to oblasti kojima se bavi u toj bolnici.
My basic training was done in vitreoretinal surgery 20 years ago. I was trained in Semmelweis University and also in the Harvard Medical School between 95 and 96. And since almost 20 years I'm coming here to Sveti Vid and doing mainly vitreoretinal surgery. The main field, the main type of surgery we're doing here in vitreoretinal surgery, they are most of the diabetic patients. Most of them they have a lot of ophthalmological complications, so they will need, sooner or later, they will need some type of surgery. The second most common disease what we deal here in Sveti Vid from the vitreoretinal surgeon point of view is the retinal detachment. In the same time, the macular degeneration, it's a very often disease. Everybody which is a little bit older, you can face this issue, and it's a bigger problem for everybody. Mainly there are two types of macular degeneration. One is dry, the other one is wet. The wet type goes with a faster losing of vision, but the good part of this is that we have a treatment for that. This treatment means intraocular injection, which sounds maybe weird at the first time, but the patient doesn't have pain at all. And if we are lucky with the injection, you can preserve the vision of the patient. The anti-VEGF therapy, it's a very good solution for the wet AMD, but we have to know, all of them, doctors and patients also, that usually in average the patient needs 3 injections every year, maybe more, maybe less. And this is not a lifelong solution. They will preserve the vision for 5-6 years, so we gain time with that, but it's not the last treatment of the wet AMD. On the other hand, we have the dry type of this AMD. The dry type, it's a little bit better because the diminishing of the vision is much slower. But sooner or later, the patient will lose the ability to read and to write, which can make his life much more difficult. But in this moment, I'm also very happy because we have also some kind of treatment which will help the patient in this condition. There is a new type of lens designed by the half German, half Hungarian doctor who lives in Germany basically, but the lens was developed in Hungary in the same time. It's so-called chariot macular lens, which help the patient and make the patients able to read even with the dry macular degeneration. One more problem which can occur, especially in big myopic patients, it's similar with the AMD, but the treatment is slightly different. Usually they need also the anti-VEGF therapy, but usually 1 injection would be enough. This is also helpful for myopes which are over 12. You can see this quite often. And without VEGF therapy, the vision will be diminished very fast. But at the moment, hopefully we have this treatment, and we still can use it for them.